There is a drill so simple you can do it right now, against the nearest wall, in 30 seconds. No equipment, no gym, no special clothing. And yet physical therapists, pulmonologists, and postural rehabilitation specialists have been quietly recommending versions of this exact movement for decades, because it directly addresses two of the most damaging and most ignored physical changes that happen to the body after the age of 50. Rounded shoulders and shrinking lung capacity. Most people treat these as separate problems. One is a posture issue, the other is a breathing issue. But here is what the science actually shows: they are the same problem. And the wall drill you are about to learn corrects both at the root level, not at the surface. Stay with this until the end, because the final part of this video explains the one breathing mistake almost every senior makes during this drill that completely cancels out the benefits. And it is far more common than you think. Let us start with what is actually happening inside the body when the shoulders roll forward and the upper back begins to curve. The clinical term for this is thoracic kyphosis. It refers to an excessive forward curvature of the thoracic spine, the middle and upper section of your back. And while mild degrees of this curve are completely normal, the exaggerated form that develops with age and inactivity is a different matter entirely. A landmark study published in the Journal of the American Geriatric Society, specifically Cato and colleagues, 2004, followed over 1,300 older women and found that those with greater thoracic kyphosis had significantly higher rates of mortality, functional decline, and reduced respiratory capacity compared to those with more upright spinal alignment. These were not theoretical risks observed in a lab. These were real clinical outcomes measured over years in a living population. Here is why it happens. When the upper spine curves forward excessively, the rib cage follows. It compresses. It narrows inward. And when the rib cage compresses, it physically reduces the available space for the lungs to expand. The diaphragm, which is your primary breathing muscle, responsible for approximately 70 to 80% of the work of respiration according to Gray's Anatomy of the Human Body, cannot descend fully. The lower lobes of the lungs, which are the largest and most densely vascularized sections, become underventilated. You are essentially breathing with only the top portion of your lungs, the least mechanically efficient portion. This is why many older adults feel chronically short of breath even during mild exertion. It is not always about cardiovascular decline. In many cases, it is postural restriction. The thoracic spine and rib cage are physically preventing full respiration. On top of that, rounded shoulder posture creates what biomechanists call anterior load shift. The weight of your head, which averages between 10 and 12 pounds in adults, moves forward of the spine's center of gravity. Research published in Surgical Technology International by Hansraj in 2014 calculated that for every inch the head moves forward from its neutral position, the effective load on the cervical spine increases by approximately 10 pounds. So a 2-inch forward shift imposes 20 additional pounds of pressure on the neck and upper back musculature, constantly, every hour, every day. The result is chronic muscular fatigue, tension headaches, reduced neck mobility, and upper back tightness that most people accept as a normal part of aging. It is not normal, it is mechanical, and mechanical problems respond to mechanical corrections. The wall drill works by using a fixed flat surface to create a reference point for the spine and shoulder blades, allowing the body to experience correct spinal alignment for many people for the first time in years, through an isometric hold rather than active athletic effort. Here is how to perform it correctly. Stand with your back against a flat wall. Your feet should be approximately 6 inches away from the base of the wall, not pressed directly against it. This slight distance is intentional. It allows your pelvis and lumbar spine to find a neutral curve rather than being forced into an artificially flattened position, which would create its own compensatory tension. Now gently bring the back of your head toward the wall. If there is a significant gap between your head and the wall, that gap is a direct visual measure of how far your head has migrated forward from neutral. Do not force the contact aggressively. Simply guide your chin slightly down and back, what clinicians call a cervical retraction, and reach toward the wall. Next, draw your shoulder blades back and downward simultaneously, pressing them lightly into the wall behind you. Not aggressively, not to the point of pain, just enough contact to feel the scapulae engage with the surface behind you. Notice what happens to your chest in this moment. When the shoulder blades retract and depress, the anterior chest wall opens. The sternum lifts slightly. The rib cage expands laterally. This is thoracic decompression, the mechanical reversal of the compression created by chronic rounded posture. And you are achieving it passively, using the wall as your reference point. Hold this position for 30 seconds. In the first 10 seconds, breathe normally and allow your body to settle. In the final 20 seconds, Take slow, deliberate nasal inhalations, expanding your rib cage in all directions, front, sides, and critically the back. Feel the back of your rib cage pressing gently into the wall as your lungs fill from the bottom up. This posterior expansion of the rib cage is the most important element of the entire drill. It is also something most people have never consciously done, because in their habitual rounded posture, the thoracic spine physically prevents it. In the corrected wall position, the posterior lung lobes have space to receive air, and when you breathe into that space intentionally, you are recruiting alveolar tissue that may not have been fully ventilated in years. Let us go deeper into what the research says about scapular, positioning, and respiratory function, because this is where most people dramatically underestimate what a simple postural correction is capable of. A study published in the Journal of Physical Therapy Science by Kim and colleagues in 2015 examined the effect of thoracic extension and scapular retraction exercises on pulmonary function in subjects with hyperkyphotic posture. The findings were clinically meaningful. Participants who performed postural correction exercises targeting the thoracic spine and shoulder girdle showed statistically significant improvements in forced vital capacity, which is the total volume of air you can exhale after a maximum inhalation, as well as forced expiratory volume in 1 second, the standard clinical measure of how efficiently the lungs move air. In plain terms, correcting the mechanical position of the thoracic spine and shoulder blades directly improved how much air the lungs could hold, and how quickly they could move it. Not through medication, not through any breathing device, simply by changing the structural environment in which the lungs operate. This is a distinction worth pausing on. The lungs are passive organs. They do not expand under their own muscular power. They expand because the thoracic cavity around them expands. And that cavity is shaped and controlled by the rib cage, the diaphragm, the intercostal muscles, and the position of the thoracic spine. When the thoracic spine is held in excessive flexion, as it is in chronic rounded shoulder posture, the thoracic cavity is in a state of permanent partial compression. Restoring the spine's position is the only way to give the lungs back their full mechanical range. The muscles activated during scapular retraction are also directly relevant here. The middle and lower trapezius, the rhomboids, and the latissimus dorsi, all of which attach to the thoracic spine and posterior rib cage, contract during this movement. According to electromyographic research published in the Journal of Electromyography and Kinesiology by Ekstrom and colleagues in 2003, these muscles are among the primary stabilizers of the scapulothoracic joint, and their coordinated activation produces thoracic extension indirectly even when no direct spinal movement occurs. So what looks like a shoulder blade exercise is functionally a thoracic spine mobilization with direct respiratory consequences. Here is something most people are never told, and it changes how you should think about every breath you take. The lungs are not uniformly efficient from top to bottom. Due to the combined effects of gravity and regional differences in blood perfusion, the lower lobes of the lungs receive significantly greater blood flow than the upper lobes. This phenomenon, known as gravitational distribution of pulmonary perfusion, was documented extensively by West and colleagues in Foundational Pulmonary Physiology research published in the Journal of Applied Physiology beginning in the 1960s and remaining clinically valid today. The implication is direct: oxygen exchange. The transfer of oxygen from inhaled air into the bloodstream happens most efficiently in the lower sections of the lungs, precisely where blood flow is greatest. When breathing is shallow and thoracic mobility is restricted, air preferentially enters the upper lobes, which are the easiest to fill but the least perfused. The lower lobes remain partially underventilated. The result is that even a person with anatomically healthy lungs can have chronically suboptimal oxygen exchange, not because anything is wrong with the lungs themselves, but because their posture is preventing those lungs from doing their most efficient work. The wall drill directly addresses this. By opening the thoracic cavity through scapular retraction and intentionally directing airflow posteriorly and downward on each inhalation, it creates the mechanical conditions for air to reach the basal lung segments, the lower lobes, where it can be exchanged with maximum efficiency. This is not a theoretical benefit. It is a direct consequence of correcting the mechanical environment that posture controls. Now the practical structure. How do you build this into a routine that actually produces lasting results? The wall drill, 30 seconds of held scapular retraction combined with intentional posterior breathing, should be performed a minimum of 3 times daily. The most clinically effective timing is once in the morning before other activity, once in the early afternoon following extended periods of sitting, and once in the evening as a recovery and reset practice. 3 repetitions per session, 30 seconds each, 10 seconds of passive rest between holds. That is 90 seconds of total work per session, 3 times per day. The time investment is negligible. The cumulative physiological effect is not. Clinical evidence from postural rehabilitation programs, including protocols reviewed in the archives of physical medicine and rehabilitation, consistently demonstrates that measurable improvements in thoracic mobility and associated respiratory function emerge after 4 to 6 weeks of consistent daily practice. Not months, weeks, because the musculoskeletal system responds relatively quickly to corrected mechanical loading when that correction is applied daily and with proper form. The variable that determines outcomes is not effort. It is not how hard you press against the wall. It is consistency and accuracy of execution. Returning the body to a correct reference, position repeatedly, and breathing correctly within that position is what trains the nervous system to recognize upright thoracic alignment as its baseline state rather than the exception. Over time, the postural muscles that maintain correct alignment, particularly the lower trapezius and deep spinal extensors, develop what exercise physiologists call postural endurance. They sustain correct alignment passively throughout daily life. And as that happens, the mechanical compression on the lungs reduces not just during the drill, but across all waking hours. Now for the mistake that almost every person makes when they first attempt this drill. And it is not about hand position, or how far the feet are from the wall, or whether the lower back has contact with the surface. It is breath holding. When people feel the unfamiliar tension of scapular retraction, because for many this is a position their thoracic region has not occupied in years, the instinctive response is to brace, to stiffen, to hold the breath as though bracing for impact. And the moment that happens, the entire respiratory benefit of the drill collapses. The physiology is straightforward. Breath holding during a postural hold activates the Valsalva mechanism, an increase in intrathoracic pressure that actually reduces venous return to the heart and temporarily increases thoracic rigidity. Research on respiratory mechanics, including work published in Respiratory Physiology and Neurobiology, confirms that voluntary breath holding increases accessory respiratory muscle tension and reduces diaphragmatic compliance. In other words, it does the opposite of what this drill is designed to accomplish. The drill requires you to breathe consciously, slowly, and nasally, while holding the scapular retraction position, long inhalation, lateral and posterior ribcage expansion, slow, controlled exhalation. The breathing is not incidental to the drill. The breathing is the drill. The scapular retraction simply creates the mechanical conditions that make correct breathing possible. Remove the intentional breathing, and you have done a shoulder blade isometric exercise. Useful in isolation, but a fraction of the compound benefit this movement is designed to deliver. Your posture and your breathing are not two separate conversations happening in different parts of your body. They are one integrated system governed by the same thoracic spine, the same rib cage, the same diaphragm. When posture deteriorates, respiratory capacity deteriorates with it, silently, gradually, and almost always without anyone connecting the two until the decline has already accumulated over years. The wall drill reverses that process by restoring the mechanical conditions the lungs need to function at their full biological potential. The research supports it, the anatomy explains it, and the clinical outcomes confirm it. 30 seconds, 3 times a day, correct scapular retraction, intentional posterior breathing. That is the entire protocol. If this gave you a clearer picture of what is actually happening in your body and what you can do about it starting today, then apply it. Find a wall right now. Because information that stays in your head produces nothing. Information that becomes a daily habit changes outcomes. And remember, after 50, your health is not built in the dramatic moments. It is built in the small, consistent, corrected movements you repeat without thinking. Start controlling those movements, and your body will reflect the difference.